Thank you so much, Dr. Friedman, for that lovely presentation. Also, thank you to the organizers of this meeting for inviting me to speak about this topic. And thank you to all the attendees that are seeing this webinar today. I want to start with the explanation what is the concept of whole person health. This is a definition used by the National Institute of Health here in the United States for an approach where when you are evaluating a patient, you look at the person as a whole. You will evaluate the clinical symptoms, but also you want to see what other factors affect their health. So you're going to look into the mental health, on the environment, physical, social, and what we want is change the shift of the focus from disease to restore and promote health and also to prevent disease. Whole health, it's also another term used by the Department of Veteran Affairs, where we are putting the patient at the center and we look into what is important for the patient, what goals does the patient have for the care. So you can see here, it starts with the patient and what the patient can do to improve their own health. And then you can add the support of professional care in different aspects that involve not only the symptoms they have, but also where they live, the mental health component, how do they deal with the stress, nutrition, and also how you can create a community that can support these patients so you can address all these concerns. So why is it important to apply this whole person approach to the care of ME/CFS? We know that ME/CFS is a complex condition that affects multiple systems in the body. The usual approach in the standard of care in medicine is when a patient has a symptom, we usually will look what symptoms, what systems are being affected, and then they will be referred by a specialist. And where they will, if they have stomach issues, will go to a gastroenterologist or a cardiologist or a pulmonologist, depending on the area where they're having symptoms. What we know is that with ME/CFS, patients will have symptoms in multiple systems at the same time. So when we try to use this same approach, we will have a comparison of this image we have here of the story of the blind men that were trying to describe how an elephant looked like. They will just go to the part that they can touch, and then they will say, you know, this is just, if they will touch the leg, they will say it's a tree, or if they touch the trunk, they will say it's a snake. And they won't have a whole idea of what the problem is. So there's something similar that happens with ME/CFS when we try to just focus in one area. Our patients will get different diagnoses. And what we want to do is being able to take a step back and see if we can find a common cause or a common mechanism that is affecting the patient that will help to address the symptoms. So this is where integrative medicine comes in. Integrative medicine is also what is considered a whole person health approach because it will focus on the patient and the patient's needs and preferences. And depending on that, based on that, then we can use different kind of interventions. The patient may need medications or may even need surgery, but also there could be some mind-body interventions, nutritional interventions, or some botanicals, herbs that can help. That the idea is that we can find treatments that have evidence that can help the patient in a way that the patient feels comfortable and is able to move forward with the care. Another important factor is that when we are talking about the care of patients with ME/CFS, we have to think about a team effort. It's very important to create a partnership because when you have a provider who can help, they may not have all the answers, but if they are open to get the information that the patient gives them, or they are open to read and research a little more, it's very helpful to have that connection. And at the same time, it's important to empower the patient and in some cases, the caregivers of patients with ME/CFS, because you are the expert in your own body. You know what symptoms you have and what kind of reactions you may have to certain treatments, what kind of responses. So it's important that both parts are working together, and that way you can advance in your care. Sometimes a clinician may not be enough to be able to cover all the needs that a patient has, and that's why the integrative medicine approach uses a team effort. You will have a provider that could be an allopathic doctor, osteopathic doctor, a naturopathic doctor, a nurse practitioner. And in the team, you may need to have support from other healthcare specialties to support the needs of the patient, like working with a nutritionist or a physical therapist, occupational therapist, or exercise physiologist. Maybe sometimes you may need to have support with a psychologist. Some other specialists that do manual therapies like massage therapy or acupuncture. And right now there's a lot of information about using health coaches as well, because they may help the patient to do the specific parts on how to do the recommendations, implement recommendations in real life when they are at home in their own environment. So we need to think about decentralizing the power. It's not just the clinician, the provider, and the patient. It's that we are all together moving towards one direction. Now, what is functional medicine? When we are talking about integrative medicine, as we said, there are different modalities that we can offer to the patients depending on their condition and depending on their preferences. Functional medicine is a modality inside integrative medicine. And the whole idea with functional medicine, the approach is that we are looking to find an underlying mechanism. When we have a patient who has a diagnosis of ME/CFS, we usually won't have two patients with the same diagnosis won't have the same symptoms, the same environment, the same story. So what is important when we are talking about evaluating a patient with ME/CFS is we do a little more investigation in functional medicine to try to identify what factors can be contributing or causing problems. So for example, we talk about maybe the genetic story, like family history, the predisposition to certain conditions or exposure in the environment from before. When we talk about triggers, we are looking at different factors that may have cause the development of ME/CFS. Some cases, patients may have started having symptoms after an infection. Some patients may have started symptoms after a traumatic event or a very traumatic surgery. So it could be different triggers for different patients. And also there are other factors that are called mediators. That is what is happening right now that is still maintaining the patient in a cycle of disease. So as you can see in this graphic, it's important when we're talking about these different systems levels. A same patient that has a diagnosis of ME/CFS may have different sub-diagnoses, may have issues with different systems as well that are all connected. And the whole idea with functional medicine is go a little deeper so you can find what common factors could be affecting this network and create a personalized plan for the patient. That's why it may not be, you may have had experience that some supplements or medications are helpful for one person, but may not have the same effect in another person. So that's the idea of evaluating and making it a customized plan for every patient. Now, what are some of the lessons that we can use that we have learned in the care of ME/CFS that may apply to patients who have post-COVID conditions? We don't know the exact frequency, prevalence of post-COVID conditions in the United States and in the world, but what we know is that there are a group of patients who are presenting symptoms that are similar to ME/CFS after they had an infection with COVID-19. Could be weeks or months, and they don't recover and continue having fatigue and some other symptoms as well. So the explanation today is we're going to talk about some management and evaluation techniques that we use in ME/CFS that can be helpful for patients who are now having symptoms of COVID or after having COVID infection. The first part, what is very important, and if I want for you to take a home message would be this, is that you need to start with a foundation that has to do with your lifestyle. We may have a lot of information and research development on having new medications, new interventions, but if you don't focus on these factors of things that you do every day in your life, you may not have the same benefit or any benefit at all from some of these other interventions. So it's essential that when you are thinking about how you can help your health, you start focusing on things you do in everyday life because you have some control over those. So those factors are your nutrition, your diet, how you manage your stress, your sleep, the activity, exercise that you're able to do, and also the relationships and connections that you have in your life. So when we talk about nutrition, we know that patients who have ME/CFS are at risk of having the nutrient deficiencies. There are many factors for this. Some of them are the long-term use of medications. So you will have certain medications that cause the decrease in levels in certain nutrients, or you may use more of those nutrients and your needs increase. Also, many patients with ME/CFS have gastrointestinal problems. They may have an imbalance in the kind of bacteria they have in their gut that triggers some inflammation and affects how you can absorb the nutrients. There's also what's called the small intestinal bacterial overgrowth that also can affect how you absorb nutrients in your gut. Dysautonomia is another factor. This is a problem in the autonomic nervous system that can cause issues of motility. Maybe patients may have a lot of nausea or reflux or gastroparesis when you feel that your digestion takes longer and takes many hours for you to digest food. Sometimes also that can be an abnormal release of digestive enzymes that help you break down food. That also can affect how you absorb those nutrients. There are also description of other problems that can affect the absorption of nutrients. Many patients with ME/CFS may have dental issues with dry mouth and not enough saliva, or have some inflammation in the gums or difficulties chewing. Also, there's description of presence of eating disorders, and in more severe cases, some patients may need to use a tube feed. So there has been description of many multiple nutrient deficiencies in patients who have ME/CFS. And that's also another area where it's important to discuss with your clinical provider to check your levels, because every person is different, and sometimes you may need to receive a higher dose to be able to get to a normal level. And you need that information to adjust the dose of the nutrient replacement, and also to identify if you need nutrient replacement. There are different ways to do this, from regular labs that you can get through your insurance for some vitamins and nutrients, to more comprehensive testing where they will evaluate many other nutrients. So even if you can start with something simple, some nutrients that are usually low or affected in patients with chronic fatigue, ME/CFS, are vitamin D, vitamin B12, folate, iron, and omega-3s. All of those are available with regular laboratories under insurance care. The second aspect we were talking about is the management of stress. We are submitted to stress in multiple facets in our life. We just came out from a pandemic that also made caused a lot of changes in our lifestyle, in our life reality. So we are, that one thing is for certain is that the stress is a constant. And as you can see in this graphic, the effect of having stress for a long time, and sometimes just the fact that you are sick, that also can be a source of stress, that can affect many systems in our body and have consequences in the long term. So it can affect your brain, can affect your heart and blood vessels, your digestion, your adrenal glands, respiratory system. So it's important that we have some kind of mechanism on how to cope with the stress, how to deal with the stress. Many times patients who have ME/CFS also have less tolerance, less resilience when there's a stressful situation. So the idea here is that whatever is your preference, you find something that you can apply and practice every day. And that way you can start training your body and your system to respond to stress better. One simple way to help is the use of diaphragmatic or belly breathing. As you can see in this graphic, when we breathe, normally when we inhale, our chest rises, and when we exhale, our chest goes down. The purpose of belly breathing is gonna be the opposite. When you breathe in, your belly goes out, and when you breathe out, your belly goes in. The way this works is that you have this between the chest cavity and your belly, there's this muscle called the diaphragm, and right below the diaphragm, the vagus nerve runs. And when you do this different breathing pattern, you are stimulating your vagus nerve. And that is helping to go into repair balance mode in your body. You can repeat this as frequently as you want, especially when you are having stressful situations. If you can stop for a few seconds, remember and start doing that, changing the breathing pattern, that's going to help to deal with the stress better. The more you do it, the more powerful intervention would be. At the end of this talk, the organizers are going to help me so you can receive some of the resources that include some links on how you can, more information about belly breathing and how you can practice with videos and recommendations. There are other interventions as well, and as I said, it depends on your preference. Some people may be able to do some Tai Chi or yoga. Some may have the ability to do mindfulness practices like meditation. And some people may need some extra support from a therapist to be able to do some other interventions like cognitive behavioral therapy or guided imagery, biofeedback. And one very important factor that is also coming up in the research literature is gratitude practices. This could be as simple as just starting your day, writing down in a notebook, in a diary, 3 things you are grateful for. But that kind of changes the response in your body, and your kind of perspective for the whole day can make a difference as well on how you handle stress. The third factor that is important and foundational is your sleep. We know that many patients with ME/CFS have issues feeling restored when they sleep, and they may wake up, may have insomnia, may have issues that affect their sleep quality. One reason why sleep is so important that is also coming up, there's more research happening right now, is about the lymphatic system. The lymphatic system, as you can see in this graphic, this represents the brain tissue. These are the meningi, and this is the skull. This red vessel brings the cerebrospinal fluid, and that cerebrospinal fluid moves through the brain tissue to clear all the waste product that we produce from normal functioning during the day. And that flow will go to the lymphatic vessels to release all this waste in the brain. So that is the lymphatic system that they are describing, and they're starting to research more. And what is important about this is that if you have issues with chronic inflammation in the brain, this will be affected, and you don't get to release all the waste products. They start accumulating, and then they cause some of the symptoms related to fatigue, brain fog, that some patients describe to me like having cotton balls in the middle of your ears. It's related to this waste accumulation. When you sleep, when you go into deep sleep is when this happens. Most of this activity happens in your deep sleep. So if you are the sleep deprived, you are going to have less release of these waste products in the brain, and that can cause consequences in the long term. So some recommendations to help with sleep from the whole medicine, integrative medicine approach is to have as much as possible scheduled time when you go to sleep and when you wake up. You can avoid drinking coffee or other stimulants before going to bed, or having some anxiety-inducing activities close to bedtime, like watching the news or reading an upsetting email, that will affect your sleep as well. Another factor is the blue screen that comes from this the blue light that comes from the screens in all the devices like laptops and TVs and smartphones will block the production of melatonin. Melatonin is the chemical in your brain that tells your brain it's time to go to sleep. So when the more you're exposed during the late afternoon hours to this light, you're blocking your own production of melatonin, and that will affect your sleep time, bedtime. So you can use, ideally would be that an hour or so before bedtime, you don't have any contact with any of these devices, but being realistic, the other option is to use something that blocks that blue light and won't affect your melatonin production. So there's many apps available for the phones and the tablets and the computers. And also there are some glasses that can block the blue light as well that can help to reset your cycle. Also, having a dark bedroom that has a comfortable temperature. And you can also, the belly breathing technique we described a few minutes ago, you can use that when you go to bed before going to sleep, will help you transition into sleep more easily. This is also important. If you snore, you should discuss, or somebody tells you that you snore, you should discuss with your clinician about having your home oxygen levels tested at home. And usually this has to do with insurance coverage. They may not cover a full sleep test from the beginning, but this home oximetry is a possibility. You kind just have the oxygen monitor, and if you have decreases in your oxygen levels at night, that will help your clinician to discuss and get the insurance approved for a sleep study to evaluate for sleep apnea. Now, the fourth component has to do with the amount of activity or exercise that you can do. We know that with patients with ME/CFS, activity and exercise can trigger a relapse of the symptoms. And we are also finding that patients with post-COVID conditions are describing this same problem as well. The idea here is that the energy production may be affected by issues with your mitochondrial function, the part of your cell that produces energy. And when you have less energy coins for the day, if you use your energy early during the day, then you won't have energy left for the afternoon. And that's when sometimes people describe having a crash period by the end of the day. Now, while we are working on other factors to help and understand why you're having this issue, one strategy to help is energy conservation, also called pacing. And the idea here is that if you are able to keep track of your activities and see how many hours of activity you are able to have during the day, then you may be able to do a little less than that limit that you have for the day. That will allow to avoid those crash episodes. Every time you have a crash episode when you push yourself and you did too much, all that energy will go to help with inflammation and some other processes that happen in your body, and you don't have really much energy left to heal and repair and balance your body. This guide that is from the World's Physiotherapy website, and you have the information here, has a lot of resources on pacing and some strategies on how you can help maybe prioritize your activities. And one of the options is also to wear an activity tracker that will help to either use your number of steps per day or your heart rate. Even now, there are some devices that measure your heart rate variability, with also a measurement. The higher your heart rate variability, the better. So those days when your heart rate variability is low, those are days that you can take it a little easier and rest more. One more thing that also I found that could be helpful for patients who have ME/CFS or have issues with energies, thinking about they may not have as much energy to organize and keep everything clean and keep up to date with the house chores, but the cluttering, getting rid of things you don't need, and some of these may benefit from the minimalistic approach, then it will be easier to maintain things so you don't feel overwhelmed. I'm also providing some resources about some areas where you can find more information about pacing or energy conservation, as well as these other activities for organization. The last one of these 5 elements in the foundation is the importance of having close relationships and connection. I would say the first close relationship you need to have is with yourself. Realize and accept and love the person you are right now, because there's a lot of changes that may have happened since you got sick, and also a grief process after things that evaluating things that you may have lost or you're not able to do anymore. So that's the first part, to be able to look in the mirror and say, I love you to yourself. And then also be able and look for close relationship. Could be either in person or remotely, but having somebody that you can connect with, and some organizations like the ones organizing this event are helpful as well. They can help you find people who are going through similar conditions as yourself, because there's research showing that when you have these close connections, and it doesn't have to be a lot of people, it could be 1 or 2 or 3 people, there's a decreased risk in heart disease and stroke. Also, the studies show that there's this lower risk of depression and dementia. Also, if you don't have the option to find human companionship, pets are also helpful. They are also some studies showing how they can help with this management of the health. Also, there's more information about now how your connection with nature can make a difference. Dr. Susan Simard has published a book called Finding the Mother Tree. And also she has a talk, a TED talk available in YouTube, where she describes the research she has done, finding how trees in a forest connect to each other through myceliae, like little organisms through the root system, and how they help each other and send all these nutrients when they are in stress or when there's not enough food or sunlight, and all connected to a main tree that's called the mother tree. And the idea here is that all that connection can also help you find balance and find motivation to find balance in your life. Recently, I saw a documentary that was describing the experience of a nonprofit group that takes patients who survive cancer through a trek through the mountains for a week, and the impact and power it had of being able to connect not only with other people, but with nature itself, how it helps with the healing and balance. I understand that some of you may have limitations. You may not be able to go a whole week to camp in a trek, but sometimes could be just something simple as going to the park, sitting next to a tree. If you cannot do that, sometimes just opening the window and watching trees and nature outside, and sometimes even just connect with a plant. You can have a small plant in your home or your apartment. That connection, finding some relationship to something bigger than yourself, can also make a difference. Some people may also have some spiritual practices as well, so that also is part of the healing. And the whole idea for all these foundation elements is that if you can implement in a simple way all of these as consistently as you can, that's a strong foundation for what any other intervention or treatment that you're going to receive. So there are a couple of more aspects that I think are relevant to share, that things that we have learned in ME/CFS that can be helpful for COVID patients who have COVID-19 illnesses or post-COVID-19 conditions. Mast cell activation is a problem where mast cells are cells in the immune system that normally will be part of an allergic response. So when you have a urticaria or anaphylaxis reaction, mast cells are responsible. They have histamine and many other chemicals, but we are finding that with ME/CFS, there's an increase in the mast cell number. And also, not only that, but they may be more unstable and they may release chemicals with other triggers, not just an allergy. The issue with mast cell activation syndrome is that it may present with many symptoms in the body, As you can see here, it could be starting from regular skin rashes or hives, but also could be associated with lightheadedness or passing out, having pain, stomach issues, nausea, diarrhea, brain fog. So it can affect many aspects in the body. What is interesting is that the research is showing that patients who have post-COVID conditions, this hyperinflammation, cytokine storm response that happen in some patients, especially who had severe symptoms, could be associated to this abnormal response in mast cells. And there's also some published cases where they're finding that medications that help to stabilize mast cells or block the mediators they release, the chemicals they release, can be helpful with symptoms with post-COVID-19 illness. So what can you do to start to evaluate or help with your evaluation or finding out if you have mast cell issues? This graphic is from the Mast Cell Society, and you can find a lot of very good information there. The first step would be to identify a trigger. And as you can see, stress is a big trigger for the release of mast cells. Also could be medications, certain foods, or strong smells, changes in the temperature, changes in barometric pressure. And once you identify the trigger, you may be able to avoid or at least decrease exposure. Foods are a big factor that can cause release of histamine in mast cells. So avoiding foods that are rich in histamine, or sometimes if you had symptoms worsening of any of your symptoms, remember back during that day if you ate some of these foods that are rich in histamine, so that could be also a clue that you may have an issue with mast cells. Well, I would recommend if you identify some of these symptoms or changes in your symptoms after these triggers, that you discuss with your clinician about completing tests for mast cell activation syndrome. This website, the Mast Cell Society, has a lot of resources, not only for patients, but also for providers. So if your provider is open, you can bring information because it describes what kind of tests can be done and what kind of treatments are helpful, medications and supplements to stabilize these mast cells. And the second big part that also affects patients with ME/CFS that can be important for patients who have post-COVID conditions is autonomic dysfunction. The autonomic system is the part of your nervous system that deals with everything you don't have to think about, everything that's automatic. So you can see here, there's the sympathetic side, has functions in many organs in the body, which is the fight or flight response. And the parasympathetic side also has many functions in the body that is associated with the healing and recovery phase. We know that patients with ME/CFS may have an imbalance between these two sides, and that can cause multiple symptoms. And what we are finding more recently in ME/CFS is that these issues with autonomic function are associated with a condition called small fiber neuropathy. These small nerves are the ones that control the autonomic functions, and they're finding that there could be some antibodies attacking these nerves. Also, there has been some research studies showing that during exercise, the heart doesn't feel completely, there's an abnormal feeling of blood that will affect how you respond to exercise. And more recently, Dr. Roy group in Hopkins also published a study where they found that there was decreased amount of blood flow to the brain in patients who have autonomic dysfunction, even if they are not having dizziness or lightheadedness. And that also can affect your fatigue and pain and other symptoms. Some similar studies have been done in patients who have post-COVID conditions, and they are finding also that these patients may have issues with tolerance to exercise and abnormal exercise testing. And also that when they did tilt table tests, they had reproduction of some of the symptoms they were having with long COVID. They also found they had decreased blood flow to the brain, and they also have been finding a lot of them having issues with the small fiber neuropathy. So what can you do to start the evaluation if you are having some symptoms that can be related to autonomic dysfunction? One simple test that you can do, that you can ask your clinician to help you with, is this one called passive standing test. Basically, you have some information here. Dr. Bateman has very good resources on her website about how to, instructions on how to do this test with the clinicians as well. It's a simple test where you will have a patient laying down in the bed for 5 minutes or so, and then you check the blood pressure, the heart rate, the oxygen levels when they are laying down, and then you ask them to stand up without doing anything, just as still as they can. They lean on the wall for 10 minutes. And then you check the blood pressure and the heart rate throughout the whole 10 minutes, and you keep track of the symptoms they have. They may have dizziness, lightheadedness, and that is a clue that we're having issues with autonomic dysfunction. But one thing that I like to do is document as well the changes that can happen in the color of your skin. This is called acrocyanosis, meaning there's the blood pooling that happens in the legs. This is a picture taken right at the beginning of the test, and this is at 10 minutes. As you can see, the changes in the skin kind of gets purple, blotchy, and this means that this blood is staying here and is not going back to circulation, and that affects, your blood pressure, your heart rate. So if your clinician is open, that's something that can be done very easily in the clinic. And if they have any evidence of changes there, then that can help you when they refer you to a cardiologist for more formal evaluation with a tilt table test, which would be something similar, but they monitor your heart rhythm and some other factors when they do the test. And that is helpful to identify if you are suspecting or if you're having issues with getting lightheaded or dizzy when you are changing position from laying down to standing up. Another thing that also is helpful now is having an evaluation by the neurologist to have a skin biopsy to diagnose small fiber neuropathy. This neuropathy won't show up in a regular electromyography and some of the other tests that the neurologists do usually, and they can say, everything is normal, but the skin biopsy can be helpful because if you find that it's a problem, Dr. Systrom in his group in Harvard have been doing some research with certain medications, and there are also other studies going on for the use of other interventions, how to help patients who have this condition. So it's important to gather information, and if you can help your provider, you have also here resources with Neuropathy Commons is from a website from Dr. Ann Aucklander, who is doing a lot of research in small fiber neuropathy, has information on how to find clinicians who do these procedures, and also information itself on small fiber neuropathy and how to diagnose it. So this, as I mentioned, is a part of the evaluation that can be helpful as well with patients who are having new symptoms after having long COVID. And this is all I have to present for today. Thank you so much for participating.